Osteoporosis is a progressive bone disease characterized by weakened and brittle bones, making them more susceptible to fractures and breaks. The term osteoporosis literally means porous bones, indicating the condition's effect of causing bones to become less dense and more fragile. This condition often develops silently over the years, without noticeable symptoms until a fracture occurs. Let's delve into a more comprehensive explanation of the 25 tips to prevent osteoporosis. Maintain a calcium-rich diet. Calcium is a vital mineral for bone health, as it contributes to bone structure and strength. Adequate dietary calcium intake is crucial throughout life, especially during periods of growth and aging. Dairy products like milk, yogurt, and cheese are rich sources of calcium. However, if you're lactose intolerant or following a dairy-free diet, consider alternatives like fortified plant-based milk, leafy greens, kale, broccoli, and canned fish with bones, sardines, salmon. Get enough vitamin D. Vitamin D is essential for calcium absorption and bone remodeling. Your body can produce vitamin D when your skin is exposed to sunlight. However, depending on your location and lifestyle, you may need to supplement your intake, especially during winter months or if you have limited sun exposure. Prioritize weight-bearing exercises. Weight-bearing exercises involve supporting your body's weight with your legs and feet. Activities like walking, jogging, dancing, and stair climbing stimulate bones to adapt and become stronger. Engaging in these exercises for at least 30 minutes most days of the week can significantly improve bone density. Include strength training. Strength training involves using resistance to challenge your muscles. This type of exercise not only builds muscle strength but also places stress on bones, promoting bone density. Free weights, resistance bands, and weight machines are effective tools for strength training. Practice balance and posture exercises. Maintaining good balance and posture helps prevent falls, which are a common cause of fractures among individuals with osteoporosis. Activities like yoga, tai chi, and Pilates focus on balance, stability, and alignment, reducing the risk of falls. Limit soda and caffeine. Colas and excessive caffeine consumption can negatively affect calcium absorption, potentially leading to bone loss. While an occasional soda or cup of coffee is unlikely to cause harm, consider moderation, and ensure you're still meeting your calcium needs. Moderate alcohol intake. Heavy alcohol consumption can interfere with bone-building processes and increase the risk of fractures. If you choose to drink alcohol, do so in moderation, adhering to recommended guidelines. Quit smoking. Smoking harms bone health by decreasing blood flow to bones and affecting calcium absorption. Quitting smoking supports your overall well-being and helps preserve bone density. Adequate protein intake. Protein is a building block for bones, as it contributes to bone structure and repair. Incorporate lean protein sources like lean meats, poultry, fish, eggs, beans, and nuts into your diet. Maintain a healthy weight. Being underweight is a risk factor for osteoporosis, as it can lead to decreased bone density. Strive for a balanced weight within a healthy range for your age and height. Limit salt intake. A high-sodium diet can lead to increased calcium excretion in urine, contributing to bone loss over time. Opt for fresh, whole foods and limit your consumption of processed and salty foods. Regular bone density checks. Periodic bone density scans, typically conducted through dual-energy X-ray absorptiometry (DXA) tests, provide valuable information about your bone health. Discuss the frequency of these scans with your healthcare provider. Avoid rapid weight loss diets. Extreme calorie restriction and rapid weight loss can lead to bone loss. Opt for gradual, sustainable weight loss strategies that prioritize nutrient intake and overall health. Consume magnesium-rich foods. Magnesium is an essential mineral that supports bone health and calcium metabolism. Include sources like nuts, seeds, whole grains, leafy greens, and legumes in your diet. Include omega-3 fatty acids. Omega-3 fatty acids have anti-inflammatory properties that may support bone health. Incorporate fatty fish, salmon, mackerel, flax seeds, and walnuts into your diet. Reduce stress. Chronic stress triggers the release of hormones that can negatively affect bone density. Engage in stress reduction techniques like meditation, deep breathing, and mindfulness to support overall well-being. Limit high-impact activities. While exercise is beneficial, high-impact activities like running and intense jumping may increase the risk of fractures, especially for individuals with existing bone issues. Consider lower-impact exercises like swimming and cycling. Regular health checkups. Regular visits to your healthcare provider allow for the monitoring of bone health and early detection of any issues or changes. Stay hydrated. Proper hydration supports overall health, including bone health. Water is essential for transporting nutrients to bones and aiding in various bodily functions. Limit inflammatory foods. Diets high in processed foods, refined sugars, and unhealthy fats can promote inflammation, which may negatively impact bone health. Opt for whole, nutrient-rich foods. Avoid prolonged sitting. Sedentary behavior can weaken bones over time. Incorporate movement breaks throughout the day to counteract the negative effects of prolonged sitting. Mind your medications. Some medications, such as corticosteroids used to treat various conditions, can weaken bones. Discuss potential effects with your doctor and explore alternatives if necessary. Consume collagen-rich foods. Collagen is a protein that contributes to bone strength and flexibility. Foods like bone broth, fish with skin, and collagen supplements may have beneficial effects on bone health. Stay educated. Continuously educate yourself about osteoporosis, risk factors, and preventive measures. Staying informed empowers you to make proactive decisions about your bone health. Consult a healthcare professional. If you have risk factors for osteoporosis or a family history of the condition, consult a healthcare provider. They can assess your individual risk, recommend bone density testing, and tailor a preventive plan to your needs.